Hi everyone, welcome to the first episode of the Sweet Recovery series. So a little bit of background on this series. I was involved in a rear-end car crash in September of 2015. And after a bunch of conservative treatments such as physical therapy, cortisone shots, you name it, my doctors decided that it would be best for me to proceed with what's called a microdiscectomy, which is where they take out a chunk of your disc that's in your spine that's pressing up against a nerve to help relieve some of that pressure and pain. That surgery turns out it was not sufficient for the damage that was done to my back. So we are moving forward. My doctors and I have decided to move forward with a lumbar fusion, which is spinal fusion. So they basically are going to take the disc out and fuse the two vertebrae together so that they form one cohesive bone. So there won't be any more, movement in that area, and the disc won't slide out and start pressing up against nerves and start causing all kinds of problems. So a way that this affected my life, like I said, it was done in September of 2015. At the time, I was a owner of a corporate wellness management company, and I managed one particular site for a corporation, and it after the accident, before the accident, I was able to do all kinds of stuff. I taught several classes per week. I felt comfortable being in charge of the gym, meaning that if somebody, had unfortunately dropped a barbell on themselves or something like that, I felt perfectly capable, perfectly comfortable picking it up, no problem, so that I could help them with any injuries that, prevent any injuries that they might have. I had no problem spotting people, nothing like that. After the accident, some things started to change. My back got progressively weaker and more painful. I wasn't able to get through my classes. The classes that I taught some very high impact, high intensity jumping, tuck jumps, jumping jacks, all kinds of stuff. Plyometric workouts. Taught those several times a week. And after the accident, I really didn't feel comfortable doing that anymore. It got progressively more painful. It got progressively worse. And as my doctors and my physical therapist and we went through all of these conservative treatments, I was going back to them and saying, hey, something's not right. This is not getting any better. As a matter of fact, it's getting worse. What do I do? So we had the microdiscectomy. I had the microdiscectomy in August of 2016. And it turned out that one wasn't quite sufficient for what I needed. It didn't work out the way that, my doctors and I had hoped it would work out. So unfortunately, because of the injury, once my contract came up for my corporate wellness site, I had to let it go. Fortunately for me, and fortunately for you, I hope, my sister and I decided to start Sue Sweet, which is a way for me to regulate my activity as I recover. So as I go through this journey, I'm going to be taking you with me. So today is Monday, and I'm scheduled to have my lumbar fusion on Wednesday. And I'm just going to be taking you with me. We're going to talk about how I'm feeling. We're going to talk about the recovery portion. And as I progress, based on what my physician, my surgeon, and what my physical therapist say, you're just going to be coming with me, and hopefully you can find some encouragement in it as well. So today, like I said, today is Monday, and a couple weeks ago, they make you go through all of these things like the pre-op phone call with the nurse, and basically she just calls you up and asks you what kind of prescriptions you're on, what kind of medications, if you're taking any type of multivitamins, probiotics, anything like that, and basically tells you what you can and cannot keep taking as you approach the surgery date. So that all started, the preparation for this started about a month ago with doctor's visits, meeting with my surgeons, making a plan of attack, so to speak, and then going through all of that to prepare for the surgery on Wednesday. So today, since it's only 2 days before, they give you these little bottles here. These are bottles of soap, and apparently it's like this super intense antibacterial soap. And they gave this to me at the hospital when I went in for a MRSA swab. So you have to go in, at least I did, have to go in to the hospital. They stick a Q-tip up your nose. I know, lovely, right? They stick a Q-tip up your nose, and they swab the back of your nose. They swab up your nose and the back of your throat to make sure that you don't carry any type of virus or bacteria that could cause MRSA, which is a very, very, very bad illness that can take over hospitals and is very, very resistant to antibiotics. So they really want to make sure that you don't carry anything that could lead to that. So unfortunately, about 50% of people do carry something like that. Unfortunately, I was one of those 50%. So they gave me an antibiotic to swab my nose for about 5 days leading up to the surgery. So I've already been on that for a few days. Today is the day that I start bathing with this antibacterial soap. Apparently you're supposed to use an entire bottle, right? Yikes, an entire bottle in one shower. So you shower, you start showering 2 nights before. So you shower with one of these on Monday night, shower with another one on Tuesday night, and then shower with the last one, the third and final one, on Wednesday morning, just leading up to the surgery. You can make sure you get all the contaminants off of your skin. So we're going to be going through all this. I'm going to take you with me, and we're going to do this together.